Hi, it's Jessica DeMassa with WTF Health. I'm here with Dr. Stefano Bini. He is a practicing orthopedic surgeon at the University of California, San Francisco, and also the founder of the Digital Orthopedics Conference. So great to have you here.
Wow, Jessica, good to be back with you. It's awesome.
So tell me, I guess, a little bit about the Digital Orthopedics Conference. Let's kick the conversation off there, because I think this is such an important event, and you guys have had multiple. So tell me a little bit about how it's set up.
Well, we set up just before JP Morgan. That means that the ecosystem we're trying to attract to talk about the deployment of technology in healthcare is already in San Francisco, and so we have an amazing, really incredible group of people showing up. What we try to do there is we try to bring everybody from the insurers to the manufacturers to the physicians in one room to talk about the deployment of technology at that last mile in the healthcare system, because I think a lot of these things get stuck.
And it's so important to have a clinician perspective on this. So tell me, I guess, how your program is developed so that you really bring in the surgeon, the doctor, the clinician's perspective in what's happening. Because I think you guys are like the original tech geeks. I mean, quite honestly, all of you guys are techies. And it's like, you're talking about just all of the different changes that are coming down the pike, whether it's from robotics or artificial reality, different things that are impacting training and your day-to-day job. So how do you bring in the physician perspective to what you're doing at the conference?
It's a really good question, because when I speak at a technology forum, there's very few physicians in the room unless they happen to run a company, right? And when I speak at the American Association of Hip and Knee Surgeons to 2,000 people, the only people that understand the technology in the room are the ones that have their own companies doing it. So my goal was to bring those two worlds together. And I'm fortunate enough to have a foot in both sides, and therefore I framed the question around something practical. Because both of those worlds are trying to solve the same problem in healthcare, which is around access, affordability, and quality, but using different techniques and technologies. So the idea of DOCSF was to say the Digital Orthopedics Conference, it's a digital conference, uses orthopedics as the unifying discussion point, the unifying paradigm. But at some point, if you develop the technology, you have to deploy it somewhere. It could be pediatrics, it could be outpatient surgery, it could be physical therapy. At some point, you got to deploy it. So let's focus on orthopedics. So your next question will be, why orthopedics?
Yes, that was going to be my next question. And I have one after that too.
Oh, very obvious.
This interview, this is how this works.
Oh my gosh, okay, well. Orthopedics is interesting. It has a very short cycle time. As a rule of thumb, within 6 months or so, we kind of know what happened. Not true in chronic diseases that could play out over a long time. We can measure outcomes and not process measures. Orthopedics also is relatively expensive, so even if you have a small impact, a small percentage impact, dollar-wise it can be a big impact. Another reason, it's relatively centralized. It's not like you have a pediatrics clinic every 2 doors. There's not that many, and they're getting more and more centralized, so you don't have as many delta points. The other thing that's interesting about us is they're relatively repetitive. Our surgical procedures in particular are consistent, which means that if you're trying to develop an algorithm around them, it's probably going to fit across multiple centers, even if the data is sourced elsewhere.
I hope that every health tech startup was taking copious notes, and if not, goes back and rewinds that about why they should work with orthopedics. That was beautifully outlined, truly, because that was one of the things I was going to say is, I was going to ask you, why should other people that are not physicians come to a Digital Orthopedics Conference? And you articulated that beautifully. I think that's perfect. I mean, and so draw that out a little bit further, I guess. Like, so down the road, for a startup company that may have a new technology, you outlined the reasons why they would want to work with an orthopedic, all of the benefits that they would get. What's the flip side of that? For the orthopedic surgeon who wants to get up to date on what's happening, even if so much of the purchasing decisions have to do with the ecosystem that they're working in. How do they take what they've learned at a DOCSF conference or a Digital Orthopedics Conference and bring that back to their institution and make a case for integrating some of these technologies?
You're hired. Yeah, thank you so much. No, here's the deal. Coming from I'm kind of a systems guy. What I did at Kaiser Permanente before, and also when I got to UCSF, and the book I wrote on change management is really about how you make things happen. And so
that's the hardest part.
It's the hardest part, and we're not given the tools. You're trained as a surgeon. You're not trained as a business person. The business person is not trained as a surgeon. So here's what we do at DOCSF, where we showcase companies that have been successful. When they come up on stage, they don't get to talk about their business case. They can talk about a case study. I went into this hospital, I did this is the outcome, and this is the return on investment, and this is what we learned from the process. Then they're questioned by people from hospital systems, and the CTO and maybe the cybersecurity guy says, listen, how'd you get past this? How'd you get past that? So you're in the audience, you see exactly how it's done. You don't have to divine it out of thin air, because there's nowhere to find this stuff. And also we add leadership sections, so we got IDEO talking about design thinking, we got Brightline, people like that, and we talk about policy and politics. So contextually as a leader, you know where Medicare is going, you know where payment reform is going, you know where the government's going to be driving. And back to this idea of orthopedics and government stuff, there's a reason Medicare picked orthopedics to launch all the alternate payment programs for all the reasons I mentioned earlier. So to your question, if you're a startup and you're trying to decide what field do I focus on, orthopedics is kind of where the wave is going. Anywhere else, you're not catching a wave. So you want to be with the wave so that you got the wind behind you, wind behind your sails, and you can sail through, because as a market has been developed for us by Medicare.
I want to go back to your book about change management.
Yeah.
So tell me, I guess, from your perspective, how do you bring about the organizational change? What's your best advice for a surgeon like yourself in another hospital system that comes to maybe a DOCSF or sees a new technology that they want to integrate in? How do they make the case for it? I mean, I know you said you're hearing the arguments in the room as the company is presenting them, but I mean, really, when it comes down to that cultural shift that needs to happen, how do you make the case for that? Do you have any good advice?
So you asked two questions there. How do you make the case for it, and then how do you make it happen?
Right.
So how do you make the case for it is a nuanced is a nuanced version of this idea that you have to solve a problem. I think that's actually not well stated, because we all have problems that we choose to ignore. Maybe it's your teeth that need to be fixed, or maybe your car needs new oil. But until it's a pain point, your teeth hurt, your car stops working, that's when you turn attention to it. So if you're trying to drive the adoption of a technological solution within, say, a department or a hospital system, look for your problems. Then within those problems, find the ones that are actually pain points. Once you find a pain point and you can solve it, people will be not quite knocking on your door to use your technology, but they're far, far more attentive to your proposed solution. Now let's just say you've identified a pain point, and that pain point resonates with leadership, and then give you a check. So
woohoo!
Yeah, big deal. And then they're going to walk away, and they think, oh, we paid for the solution, of course it's going to work.
It's going to implement itself, right?
Won't it? It's a shiny object, this technology is modern.
Just download it from the App Store, it's fine.
Precisely. Let's use that model.
Okay.
So when you download from the App Store, you're taking that app and putting it into an ecosystem against which you've already been socialized. You know how to use an interface without buttons on it, and you know that you click on it, you know exactly what to do. You don't have to be told. The problem with healthcare is that app falls into basically a desert. It falls into, there's no operating system that works with that app. So 90% of these deployments fail, not because the technology didn't actually solve the problem, but because there wasn't a sufficient investment in socializing that tool within the healthcare system. So in my book, what I wrote about is called the team engagement strategy, is how does a leader who may or may not have a budget or stripes on their shoulder, namely power, social power, they may have capital, social capital, but they don't have a power to drive change. And it sort of builds on the whole idea of decentralizing decision making, providing a framework with your team and let them solve the problems they've always wanted to solve, and provide a feedback loop. It's not that complicated. It was novel enough that we did our research that it's actually a new model, and we published it, and it's doing really well, but this idea of driving change, if you've identified a pain point, it's a matter of corralling your resource and telling people, now you finally got an opportunity to solve that problem, it's been driving you crazy, let's do it together. And leadership should enable the front lines to adopt that change and have a rapid improvement model behind it, and then it'll work just fine.
Stefano, thank you so much for joining us. It's a pleasure to talk to you. Best of luck with the next Digital Orthopedics Conference.
Yes.
Thank you. I'm Jessica Damaso with WTF Health. Thanks for joining us.